Hi everybody, welcome back to UWorld's Next Gen NCLEX review session. My name is Jackie and I'm a nurse here at UWorld. We're so glad to have you guys with us today. We are going to be covering cardiac questions. So if you are new to one of these question drill sets, what you can expect is we will pull up a question, we'll read it to you guys, give you about 30 seconds to answer, then we'll walk through why the correct answer is right and why you might have got tripped up on some of the incorrect options. So we're glad to have you guys with us. Be sure and share this session, ask us questions. We have our team of experts moderating the chat, and be sure and follow us on your favorite social channel. We're so glad to have you be part of our UWorld community. So with that being said, let's go ahead and jump in. We will pull up the first question for you. All right, question 1 says, the nurse is caring for assigned clients. The nurse should first assess the client who has, option 1, chronic obstructive pulmonary disease, a pulse oximetry reading of 91% on room air, and reports a chronic cough. Option 2, atrial fibrillation, an elevated heart rate, and reports an occasional fluttering feeling in the chest. Option 3, fibromyalgia, fatigue, and reports generalized pain rated as 7 on a scale of 0 to 10. Option 4, heart failure, edema of the lower extremities, and reports dyspnea. All right, 30 seconds on the clock. Go ahead and drop those answers in the chat. We are so glad to have you guys with us. If you're just joining, we're covering cardiac questions. As always, we encourage you guys to share this session, follow us on your favorite channel, and check us out at uworldnursing.com. You can subscribe to our event calendar. We have our calendar of all of our live sessions coming up, so be sure and check that out. I'm going to check the chat. You guys are doing awesome. We've got a lot of great answers coming in and a lot of correct answers, which is great. So with that being said, I'm going to go ahead and pull up the right answer. So our correct answer on this one is going to be option 4, heart failure, edema of the lower extremities, and reports dyspnea. Okay, so first what we see in this question, the word first is bolded. So that's going to mean this is a priority question. So we're going to prioritize what we're seeing in these options. And we're seeing a combination of different things. So we're going to first kind of focus on our ABCs, airway, breathing, circulation. So that's kind of one of the first things we can do. And then what we're going to do too is kind of look at what different disease processes are being presented and which options indicate maybe complications versus expected findings. And that's exactly what we're seeing in option 4. So heart failure is a progressive condition. We're going to have impaired ventricular function, and it's going to cause decreased cardiac output. And that's, again, going to cause inadequate tissue perfusion. We're going to have some blood that can back up into our lungs and also our systemic circulation. This can progress to cause pulmonary edema, which can be life-threatening along with left-sided heart failure. And then fluid, again, that in our lungs and our vascular space, that's going to cause impaired gas exchange. So when we're seeing heart failure, edema in the lower extremities, and difficulty breathing or dyspnea, that's going to key us in that this is the first person we need to see. We're having some breathing and some circulation problems. So that's going to be our priority. What we're seeing in options 1, 2, and 3, these are all expected findings with these conditions. So not that we don't need to follow up on them, but our priority is going to be the option that's showing a complication versus something that's expected. So you guys did great on that one. All right, moving right along, question 2. The nurse is assessing a client who had coronary artery bypass graft surgery 1 day ago and notes muffled heart sounds on auscultation. Which of the following actions should the nurse take? Option 1, administer IV furosemide. Option 2, notify the healthcare provider. Option 3, place the client in the semi-Fowler position. Option 4, document the finding in the client's electronic medical record. All right, 30 seconds on the clock. Go ahead and drop those answers in the chat. Again, we're so glad to have you guys with us today. Let us know too where you guys are in your nursing school journey. We love looking through the chat, seeing kind of where in nursing school you guys are joining us. If you're a brand new nursing student, if you're getting ready to take your NCLEX, let us know. We love to hear all of that. All right, you guys are doing good. Just checking in on the chat. A lot of great answers coming through. And we've been, with this question drill set, we have a lot of single best questions for you. So we'll save our SATA or select all that apply for the end, but hopefully we'll be able to drive home a lot of good content for you guys. All right, So our correct answer on this one is going to be option 2, notify the healthcare provider. So this is always a tricky option choice to pick as being correct. A lot of times we know that's not going to be the correct answer, but it can be the correct answer, which is what we're seeing in this question. So what we're seeing here is a client who had bypass surgery, but they're noting something that could be indicating a complication. So what we're seeing here with muffled heart sounds on auscultation, this can indicate cardiac tamponade, which is a life-threatening complication. So it can happen from pericardial effusion. So when you think about like pleural effusion, we think lung fluid in the lining of our lungs. That's the same idea with pericardial effusion. We're having fluid in the lining of our heart. And this again can be a complication after having bypass surgery. So in cardiac tamponade, the heart is going to be compressed by that fluid buildup and it's not going to be able to pump effectively. So we're going to have decreased atrioventricular filling and contracting. So our heart's not going to fill up appropriately and it's not going to squeeze or contract appropriately. So treatment of this is going to include an emergency pericardiocentesis, which is essentially going to drain that fluid from our pericardial space. And this is something a nurse can't do, so we need to notify the healthcare provider. What we're seeing in options 1, 3, and 4, while these may be helpful, what we really need to do and what is going to be the life-saving action for our client, the safest action for our client, is going to be to notify the healthcare provider. So again, we need to take that emergent action, which is to notify the healthcare provider so we can initiate the life-saving measures of pericardial centesis. All right, good work. Moving right along, question number 3. The nurse is preparing to administer digoxin to a client. Which of the following findings would require follow-up prior to administering the medication? Option 1, heart rate of 56 per minute. Option 2, temperature of 99.1 Fahrenheit, 37.3 Celsius. Option 3, respiratory rate of 22 per minute. Option 4, blood pressure of 115/75. All right, 30 seconds on the clock. Go ahead and drop those answers in the chat. Again, it's so great to have you guys with us today covering cardiac questions. There's a lot of different avenues and elements that we need to know about cardiac questions. Our question bank here at UWorld has hundreds of cardiac questions, so everything you need to know from intervene questions, prioritization questions, medications, different things like that. So if you're new to the UWorld community, we hope you'll check out our product. We have a free trial available for you guys as well. So you can find all that at uworldnursing.com. All right, looks like you guys got your answers in the chat. I'm going to go ahead and pull up the right answer. So our correct answer in this one is going to be option 1, heart rate of 56 per minute. So essentially what we're looking for on this question, it says require follow-up. So this is something that's going to indicate one of these option choices is not going to be safe for the client. So this is kind of a limitation to the medication for digoxin, like a reason why we wouldn't give it a stop for the medication, if you will. So digoxin is a cardiac glycoside, and it's given to clients a lot of times that have heart failure. So it's going to increase that myocardial contraction or that squeeze that the heart muscle gives to pump blood out to our body. So this is going to, again, increase that cardiac output, improve that circulation and that tissue perfusion. So digoxin can be pretty dangerous if it's not in a therapeutic window. So digitoxicity is something that can commonly happen, and that's why administration of digoxin requires a lot of kind of oversight, a lot of checkpoints, and one of those is the heart rate. So we are going to hold this medication if the client's heart rate is less than 60, because again, if that medication becomes too highly concentrated in the client's blood, it can cause toxicity to the client. What we're seeing in options 2, 3, and 4, none of these are really super alarming. Not going to cause us to not give digoxin. Maybe you guys got a little bit tripped up on option 4, but blood pressure is not impacted by digoxin. It's more the heart rate. So you guys did great on that one. Well done. Again, just know that heart rate is a limitation to give digoxin. All right, next question. Question 4. The nurse has taught a client about the prevention of deep venous thrombosis, or DVT. Which of the following statements by the client would require follow-up? Option 1, I am not at risk for developing a new DVT because I have had a DVT in the past. Option 2, I will plan rest stops during long car rides to get out of the car and walk around. Option 3, I should wear compression stockings on days when I am working long hours. Option 4, I will notify my healthcare provider if one leg looks larger than the other. All right, 30 seconds on the clock. Go ahead and drop those answers in the chat. DVTs are a huge part of what you'll do when you get to become a bedside nurse. DVT prevention is something every single client that walks into an acute care setting will need to be evaluated for, assessed for, and different interventions performed for. So it's really important to know everything there is to know about DVTs as you're becoming an RN, working at the bedside and educating clients. All right, you guys did great on that. Chat's looking good. I'll go ahead and pull up the right answer. All right, so our correct answer on this one is going to be option 1. I am not at risk for developing a new DVT because I have had a DVT in the past. Okay, so this question says, which of the following statements by the client would require follow-up? So our correct answer is going to be the incorrect statement. So something that we need to be like, oh, that's not right. Let me help you out here. So that's what we're seeing in option 1. So again, that requires follow-up is going to mean the statement's not safe, and it can indicate incorrect understanding for the client. So DVT, again, is just kind of think of it as like a blood clot that forms in our large veins. And when we see thrombosis, thrombosis means kind of like not moving, but thrombi can embolize, which means they start making their trek somewhere. So that can either end up a blood clot in our lungs or in our brain, causing stroke or major complications. So that's why it's so important that our clients are educated and that we as nurses can identify those risk factors. So one thing about DVTs, it's not a one and done type of thing. So if you've had a DVT in the past, you're actually more susceptible to future DVTs in the future. So we would want to make sure this client knows that they have an increased risk for DVTs. What we see in options 2, 3, and 4, these are all appropriate. These are accurate. These are good ways to minimize our risk of DVT and make sure that we're doing everything we can to keep blood moving, keep blood pumping, especially knowing when to notify a healthcare provider and wearing those compression stockings. And as nurses, that's so important for us just to wear those compression stockings, help that blood get pumped back to our heart. All right, good job, you guys. Moving along, question 5. The nurse in the emergency department is caring for assigned clients. Which of the following clients should the nurse assess first? So another priority question. Option 1, a 32-year-old client who has right lower quadrant abdominal pain and rebound tenderness. Option 2, a 54-year-old client who has severe back pain and a pulsatile mass in the periumbilical area. Option 3, a 75-year-old client who has fever, nausea, and left lower quadrant abdominal pain. Option 4, 87-year-old client who has confusion, suprapubic pain, and dysuria. All right, 30 seconds on the clock. Drop those answers in the chat. You guys are doing great. We're on the downhill slope of these questions. We have 8 questions today, so y'all are crushing it. I hope they've been helpful for you. I know that when I was learning cardiac, like just anything cardiac in general in nursing school, especially ECGs, that was so tricky. There's so many medications, so many different conditions, so much to remember about cardiac. So we have tons of resources available at UWorld, lecture videos, tons of practice questions, and a lot of online resources through our social channels. So we have several live lecture series that we have on all different elements of the cardiac system, AFib, heart failure, ECGs, everything you need to know. So be sure and check that out. All right, our correct answer on this one is going to be option 2, 54-year-old client who has severe back pain and a pulsatile mass in the periumbilical area. So again, when we see that word first, this is going to mean a priority question. So we're going to think ABC. So what we're seeing on this one is definitely circulation. So what this option choice is alluding to is an abdominal aortic aneurysm. So it's a blood-filled bulge in the abdominal aorta. It's caused by weakening in that vessel wall due to increased pressure. So we can call these AAAs. So AAA dissection, which also means blood leakage into a vessel or a tear, can rupture, and it can manifest as an acute onset of abdominal pain, and it's going to radiate. That pain's going to radiate to the back, and a lot of times this can lead to hemorrhagic shock. So the client's symptoms can indicate like that they're having impending rupture. So we definitely need to assess this person, notify the healthcare provider, just give our attention to them first. The other conditions that we're seeing, what we see in option 1, appendicitis, option 3, diverticulitis, both of these are very important, but we're not thinking rupture, major circulation, hemorrhagic shock with these at this point from what we're presented. Option 4, UTI, if we're adding into the kind of cascade of prioritization, it's okay. We're going to keep going. We just had something fall in the background, but we're all good. Okay, so what we see in option 4, when we're prioritizing, it goes airway, breathing, circulation, then we worry about safety and infection. So that's what we see in option 4. Okay, moving along. We're good. I'm so sorry that happened. Okay, so now we're on question 6. The nurse is reviewing new medication prescriptions for a client who is receiving clopidogrel. The nurse should clarify the prescription for option 1, metoprolol, option 2, furosemide, option 3, omeprazole, option 4, levothyroxine. It's always fun and interesting when we're in the studio here at UWorld. And I hope you like our new backdrop. The was a good effort to get it up, and I think you can tell by what fell behind us. It was, we did our best. Okay. All right. So again, I'll give you guys about 5 more seconds. Again, thanks for putting your answers in the chat, and we will go over this one next. All right. Our correct answer on this one is going to be option 3, omeprazole. Okay, so we are looking for clarify. So this is going to indicate that we, again, have a safety problem with this with this medication. So clarify is going to mean that we have a complication if we give this other medication. And that's what we're seeing with omeprazole, which is a PPI. So omeprazole is going to make clopidogrel less effective. So again, omeprazole is a proton pump inhibitor. It's used to reduce the amount of acid in the stomach, and clopidogrel is an antiplatelet medication, so something we use to prevent blood clots. So an alternative is going to be pantoprazole or Protonix that we can give. All the other medications, these are safe to give and really commonly given together with clopidogrel. So again, it's important. We know clopidogrel is going to prevent blood clots. We know blood clots can be life-threatening, so we don't want anything to interfere with the effectiveness of that medication. All right, moving on. Question 7. The nurse is caring for a client with a newly diagnosed atrial fibrillation. Which of the following actions should the nurse take? Option 1, prepare the client for immediate cardiac defibrillation. Option 2, instruct the client to bear down using the abdominal muscles. Option 3, teach the client about the need for long-term anticoagulation therapy. Option 4, monitor the client's laboratory test results for an increased serum TSH level. All right, 30 seconds on the clock. You guys are doing great. Thanks for sticking with us. And again, if you guys are just joining, we are covering cardiac questions. We've kind of covered a good mix of different complications, conditions, medications. This will be available on demand when we're done. So thanks again for being with us. And again, be sure and check us out at uworldnursing.com. We have tons of great resources. We hope it can be your you're opening the door to the UWorld nursing community. Lots of great resources, our event calendar, and ways you can engage with us. All right, I'll go ahead and pull up our correct answer. So our correct answer on this one is going to be option 3, teach the client about the need for long-term anticoagulation therapy. So when we're talking about atrial fibrillation, we know our atrial, how our atria are communicating with the rest of the heart is off. Our atrium are going to be quivering. So they're not going to be having a coordinated action or squeeze with our ventricles. They're kind of doing their own thing, and they're really glitchy. So one thing that our atrium have is an appendage. And so whenever we have kind of uncoordinated activity happening with our atrium, our blood is going to swirl in there, and we're going to have a higher propensity for blood clots, especially in this little appendage that's on our atrium. So these clients are going to need lifelong anticoagulation treatment or therapy. So they're going to be on an anticoagulation medication to make sure we don't have a blood clot. Because again, once those blood clots, those thrombi embolize or travel, the next place they're going to go is going to be our lungs, our brain, and we're going to have life-threatening complications from those. So that is definitely going to be one of the main things we do. What we see in option 1, that's not going to be something we need to do immediately. There's a lot we can do before. Defibrillation, we have no indication that we need to defibrillate the client. Instructing the client to bear down using abdominal muscles, this would be something we'd do for like SVT. And then option 4, serum TSH, this would be more related if we had bradycardia. We might be thinking hypothyroidism. But again, what we see in option 3, this is the most appropriate intervention for AFib. All right, moving along, this is question 8, our last question. The nurse is assessing a 54-year-old client during a routine physical examination. Which of the following findings would increase the client's risk for developing hypertension? Select all that apply. Option 1 has a first-degree relative with hypertension. Option 2 smokes 1 pack of cigarettes per day. Option 3 history of obstructive sleep apnea. Option 4 history of melanoma. Option 5 BMI of 30 kilograms per meter squared. All right, again, this is select all that apply. We're going to have more than one right answer. Go ahead and drop those answers in the chat. And again, be sure and check us out at uworldnursing.com for our event calendar and ways to engage with us. I'll give you guys about 10 more seconds. You're doing great in the chat. Thanks for sticking with us. And looks good. All right, I'm going to go ahead and pull up our correct answers. Our correct answers are going to be options 1, 2, 3, and 5. So again, we are looking for risk factors for hypertension. Pretty basic. These are easy things that, we'll learn when we learn about heart disease or hypertension, anything like that. So what we see in options 1, there can be a family history, kind of genetic component to hypertension. Smoking, of course, can contribute to hypertension. That plaque buildup in our vascular system, obstructive sleep apnea, obesity and other conditions related to obesity can cause hypertension as well. So it's making our heart work harder, and that's kind of how obstructive sleep apnea ties in with all of this. And then what we see in option 5, a BMI of 30 is going to again, be part of that obesity risk factor. So again, options 1, 2, 3, and 5. Option 4, unrelated, but you guys did great on that. Again, a good way to go about those SATA questions, take a true-false approach to what the question is asking, and hopefully that can help you get those right answers. All right, thanks for sticking with us, guys. We hope you enjoyed this. Again, this will be available on demand on our social channels.